Welcome to the Compromised to Alchemized podcast, and I'm your host, Dr. Neel. I'm excited as you join me in this journey to listen to my conversations with some of the leading experts in the field of healing from a broad range of disciplines. Welcome to the Compromised to Alchemized podcast with Dr. Neel. I'm here because I'm excited to intro the interview that I did with Dr. Erick. He is a pediatrician from Guadalajara, Mexico. We connected just prior to my January bodywork Airway centered training that I did. And he, along with a couple other amazing people, zoomed in to present to my people. So that was the beginning, and it's been a ride since then. So you'll see this is split up into two. Part one, part two. Part one is Dr. Erick getting into what he does and how he sees healing as a pediatrician. Of course, he's going to delve into some of his niche within pediatrics, which is how to look at the proper airway and feeding function, how to look at tongue tie, tethered oral tissue, and a range of other issues. And we definitely get into broader topics. So I'm excited for you to tune in. And also, the part two will be exciting so just in case you skip to part two, and we get into a little bit more of some esoteric content and some more abstractions on, talking about what is our personal legend, to borrow the term from The Alchemist. He also talks about the mentorship that I've done with him, for him. And, humbly, I say that I'm learning from Dr. Erick, and I think we all are going to learn from his childlikeness, curiosity, his expertise, and his willingness to seek continually the answers that he doesn't have. And even if he knows he could be the one to find them out, he is glad to and happy to refer. And that is such a wonderful thing. So stay tuned and dig in and just kind of get excited, because you're going to hear a great interview. And of course, I'll be excited to see what you think. Dr. Erick is here, and it's so good to have you here. We've had so many, I can't tell you how many WhatsApp conversations we've had where I'm driving on my trips or whatever, and you're just in a flow and you'll respond. And we have had some of our greatest ideations while we're in this WhatsApp flow. But I want to jump in and say how we met, because that feels exciting. And then we're going to get back to the colors of my logo, although that's not the main thing here. The main thing is I want to bring everybody, you have a reputation that is preceding you, and everywhere I go, I'm going to tell at least one or two people who I'm collaborating with about you, and not to tell them they need to go to Guadalajara, which, some of them I do say that, but more like there is someone like Dr. Erick. Well, there is only one Dr. Erick. He is there. However, you're definitely a unique healer. Of course, I need to say you're a pediatrician. So those who don't know you, they can find that out about you. You have, a wonderful Instagram post. This is how I found you. And you just really, but beyond that, I could tell you just exude this curiosity, this excitement, this zeal, this penchant for learning. And not just that, but I saw one of your videos where you were engaging with primitive reflexes on an infant. And of course, knowing that you have done training with tethered oral tissues, I'm like, who is this guy, and why do I not have someone like him near me? Because all the babies and kids and families that I see, like, I want you to be there for them. So it's been really fun to collaborate on at least one case, but just to have this flow with you has been wonderful. And to kind of close the loop on how we met, it was in Reading. I did a training there before I moved, and that was in January. and
Uh-huh.
I did a training for the body workers there, of course, so that they could get trained up. So when I left, I would leave my craft, as much of it as I could. And you, along with Dr. Suraj Vatish and Melissa Mugno, zoomed in to present to the attendees of this airway centered bodywork training, and I was like, just they knew it was very special, but I just wanted to make sure. Do you all know how special this is? These wonderful and amazing people are just so accomplished, but more than that, they care so much. And, anyways, a long introduction, but I just wanted to make sure that we started off with how we started off. And then I'm so happy to have you here. Thank you for being here. Please tell us, like, you're in Guadalajara, and just tell us, just kind of how you're doing today. And then um, we'll just start right there. And any more about yourself that I didn't share that you want to, just so people have a better idea of like who you are day to day and what you're doing.
Well, first of all, Neil, thank you so much for having me. I mean, everybody says it, but I think it's an honor, really. Like I told you before we got recording, I mean, uh, and you and I have built a relationship, and then along the way, we have found so many connections. It's like this big community and worldwide. And God bless for social media. I mean, to me, social media has been more on the upside than the other way around. So and social media was what connected us. And I know that's what you use to connect to so many amazing people. I've listened to all your recordings, to all your episodes, and it was one of your posts, and I think Suraj Vatish in London, he posted it that he was going to be on your Airway seminar, and I think I just liked it or something like that, and then you DM'd me,
Yeah,
and
exactly.
it was like hello, and I know you've been also connected to the Breathe Institute in California. Shout out to Dr. Zagi and Layli and all the team, because I consider them a place of mentorship. So you DM me, and we hit it off, and then you were kind enough to invite me to say, "Hey, I'm gonna have this event. It's important for me, and I'm gonna have this couple of guests. Would you mind? It's just last minute. Would you mind to be in?" I was like, "Of course, I don't mind. I'm more than happy to be there." And it was just a 10 minute uh, uh, of my time sharing my experience as a pediatrician in Mexico, which, by the way, Guadalajara is a long name. Sometimes it's Arabic, and so sometimes Guadalajara for English speakers, it would be kind of hard. But it's a big city down southwest of Mexico. So here's where I practice. I was born and raised here, and that's how we connected. And we talked about Airway, and you mentioned primitive reflexes, and you mentioned a lot with your floor of the mouth, which is so amazing to me to keep discovering the connections of all the tissues of the fascia and the livelihood of a human body, and then your connection to embryology and the meaning of your term and your modifications of the letters for embryology. So that's what I am all about. I've delved into from being a pediatrician and starting at the tongue and oral tissues. And then that was like, as you mentioned with your guests, you go down the rabbit hole and you never end up saying, stay curious, keep exploring, because there's always more. So I think that's Dr. Gigi Tadros from New Jersey, who's an amazing physical therapist. She said, "What happened to you that you got like a different lens through which you see health from the start?" And also, Neil, when you're a pediatrician in Mexico, you're usually the primary care physician. So before you go to a body worker as a caregiver with your baby, with your child that has issues, you first go to a physician. And so I guess that also gives me like a point of privilege,
Mm-hmm.
because they're not going to seek they're gonna look out. Well, eventually they're gonna looking for an orthodontist or a pediatric dentist or a body worker or a chiropractor like yourself. But who's gonna be like the not the gatekeeper, but who's gonna be the one that gives that orientation, right? For the parents. I think that's where I see myself as a help, you know, because I may not, and as a pediatrician, I sometimes I say jokingly, but it's real. I know a lot about everything, but at the same time, I know nothing, you know, because I know a little bit about your field, but I cannot give therapy, or I can never, even if I finish your course of floor of the mouth protocol, I won't be able to give therapy to a patient. I mean, the only thing that I do the most, and I'm like being focusing on, is perfecting my procedure of frenuloplasty, uh, to do the best that I can in doing this freeing up of the tongue, and just not leaving it there to say just that's just a procedure and just a small piece of the puzzle, and then let's connect with everybody else, even energetically, right? Because we know, like I was reading before we got on about interoception, right? And I wrote a quote over here, and it was like real quick. I may have lost it, but it was, yeah, here. It was about the nervous system and primitive reflexes, right? The nervous system as a, you're gonna love this one, as the meaning maker, right?
Mm-hmm.
So, and this concept of interoception and proprioception and the vestibular system and all the thing with primitive reflexes you had on your show, Josh Matson, and how much you and him know about primitive reflexes, and how many things, if you have like this mental models, you know, you have these basic mental models, you could learn so much about the amazing ways the body is able to heal, and you with your hands, like with your magic, how you can guide that body and that person and that energy. You can help with your energy, make it heal by itself, right? I can stop whenever you want, but
No,
and then
I think it's great. I'm gonna quickly get back to you, but I just feel like you said so many um, remarkable things, but it's more like the lens from which you speak that, just like Dr. Gigi was saying. And I think this is the positivity that you have, and also you are a point person and a liaison, and
mhm.
you have this perspective where you can see, you know, this panning out view of what is somebody, because that's a very much an integrative model, and you have to at least call what you do integrative. You can call it so many remarkable adjectives, but when you know so many different aspects of healing, and you can hold space for the interoceptive, then you jump to embryology, and then you jump to, you when you study these fields to the extent that you do, and I know what you're saying you're not necessarily an expert in all of those fields, but as an expert in what you do, you also know those fields, and that is more than a lot of people. The breadth of knowledge that you have is more than a lot of people will know. So because you can see this broadly, this far, this wide, you can see things beyond people's field of view, and this can mean other providers and practitioners as well. So that means that you can occupy that role as a bridge and as a point person, and in fact you're needed for that. That's what you need. I think it's really amazing when then at some point, like in a recent case that we had, and we can just say that you were that. You're the reason that the glue of that case, blossomed into having multiple ones of us. Because if it wasn't for you, I wouldn't have been brought in to be the expert body worker in that case, to help someone prepare for and to post-op for their frenuloplasty. And we could talk about that, but I more wanted to say it as an example of you corralled us, you brought us in, and then you defer to us. And that's huge because you gotta hold and then let go, and this giving and letting go and that surrender, to where you didn't need to be in control of things, but we wanted to we would keep you in the loop because you saw the case from the beginning. So there were times that I wanted to tell you what was going on because I wanted to make sure that you knew because you saw a broader picture. I'm used to carrying that role in a lot of cases that I have. But then there are times when I need to do just that, and I'll defer to somebody because they're there on the ground in person, and they're going to be the ones that'll walk people through the physical aspects of the healing. But let me just say, without finding success or even we need intent, right? We need to intend towards something, and then we can see it manifest. And I think you do that a lot with your work. You look at the intention of healing for the person that you're guiding, and you look with intention, how can I foster that? And then you look to see who needs to be involved, and you reached out to me as one of them. So I didn't want to take your momentum away because you were in a flow too, but I just want to thank you for what you do with that, because this is not only is this very unique in a pediatrician role, because we could make the whole podcast about that, but I don't want to limit it to that. You're very extraordinary as a pediatrician who looks at things that most pediatricians don't. And also then you can say, and as a provider and as a healer, you also are very unique in that you'll look beyond, and almost like I see with you is like, you're like, okay, yeah, I see this, and this, and this. What do I see? What's beyond this that I can't see? So that you don't even know what you can't see, but you know to look beyond where you can't see. And that's when it's like, I love that. So just to want to commend you on that. I mean, I respect you greatly. I esteem you greatly. And this is why I talk about you wherever I go. Cause I'm like, I know we can't necessarily find you, Dr. Erick, in your city, but first of all, we can always connect you. And second of all, just know that exists. And so you don't have to settle for what someone's telling you. And of course, I think there's amazing medical providers and pediatricians that are doing their work, but to be able to rely on the breadth of expertise that you have, that just I know that for me, I can have assurance that you're going to see multidimensionally into these people and these cases, because cases are people, and people are connected, and we're all connected, and we're all one. So I love that you care for people as if you're one with them, because that's the truth. And so and I want to quickly say, Dr. Erick, keep going, but I wanted to say that you listened to my podcast. You were telling me this before we started recording, and I'm so honored that you've listened to my podcasts. And this is one thing to mention it and say it, but then you've really sort of perused, and you read those who have seen it from the beginning. It was called Embryology with a J. Which if you listen to it, you can understand that's a nod to my Indian heritage, and the JI instead of the GY in the embryology. But then I shifted and called it Compromised to Alchemized. And that is a journey of how can we take people from a compromised airway to an alchemized airway. And then my wife Dawn was like, what if we get rid of, I love that, but if you take away airway, then you broaden it to make people the highlight, meaning how can we go from compromised beings to alchemized beings? And how can we go from compromised to alchemized? And that is like you've heard it, right? It's a non-linear journey. It is messy. It takes a village. But you know what? If we can combine forces, we can do this. One person cannot do this alone, whether you're the person seeking healing or whether you're a healer. We need a team. We need to rely on each other. We need that interdependence. So this is also why I'm excited to have you on, because I think you can understand those words, and we've talked about them, the compromised word and how that is a negative, but at the same time, when we have something called alchemized, we can see that it's way more than just physical healing. It's about our whole being. So maybe that's my segue back to you. I would love to hear your thoughts on how do you view that phrase, compromised to alchemized? My team helped me with the branding and the colors, and I went through a bunch of them, and it's very simple, but I really love the way it looks, and to me, it just connotes the compromised leans forward with momentum. If you see those letters slightly leaning to the right, and alchemized stands tall, and it stands broad, and it's confident. and it's secure and it's integrated. So that's kind of the symbology behind it. Tell me anything, but tell me, how do those words hit you, and how do you see your role as a healer, as a pediatrician, in helping people go from compromised to alchemized?
Oh yeah, I do agree with you that it goes beyond the airway, and to me, and then like you mentioned, and you read out compromise, and in Spanish, compromise is commitment. So
Mm.
commitment to so it's not constrictive, it's not
Mm-hmm.
it's not a limitation. And
Okay.
then as just not long ago, I finished reading again The Alchemist, the book,
Yes.
and we know, like alchemists, they would like to do things to turn to find ways to find gold, right? And your words of alchemize, they stand tall. I like it's like a three lines of each letter, right? It's like it has this small division, and it stands out because it's also like rectified, and it's also taller, and it's golden. So and the alchemy of transformation, evolution, and then at the same time, you need elements to connect, right? And you said it takes a village, so that's what it means to me. As a pediatrician, I don't know, I've been practicing for 18 years, but through this lens that it's been happening exponentially over the past 2 years. I've said to so many people, I don't know where I was as a pediatrician before this. Because it's impossible to go along helping as a pediatrician. And I don't know if it was one of your episodes or when you went to Airway, the other podcast, you got invited to Airway project. And the fix before six that I love, their motto, fix before six. But it's the host, she mentions, we are dealing with not with infants, not with pediatric patients. We're dealing with the future adults, right? And then you see what happened with the case we had together. That was like so impactful that uh well, she's a young adult that came to me because again her myofunctional therapist found me on Instagram, and she knew I was in Mexico, and her patient friend was an hour drive from my place, and she sent her to me, and you imagine that was a complex case, right? Speaking about airway, speaking about the cranial facial complex, and how many. I mean, this blows my mind. All the and with that connects with embryology, how you can find and you know more about this from the origins, how you can identify so many things that could be compromised if you have misalignments or alterations or not identifications of problems in the cranial facial complex, right? So she comes and she has a long history of procedures done wrong, and I just, yeah, I let go, as you said. But what I mentioned was like the missing piece is the floor of the mouth and laser therapy.
Mm-hmm.
And since you are considering going to the Breathe Institute to do your third and like definitely the best release you need to have, you need to find Dr. Neel. And
Mm-hmm.
because he needs to be part of the process, you may have a lot of tension, and it's a compliment from the myofunctional work you've been doing. You need a good body worker, floor of the mouth specialist, people that's not someone that's knowledgeable about lasers, and God bless you were there. And I tried to call you. Remember, I tried to call you right away
Mm-hmm.
on a video conference call, and you were busy, but we ended up connecting. And less than 2 months after that, she was already there. You have the evidence, like a picture taken, and then first with you, and then with Dr. Zagi, and let's hope she's doing well with the journey she's having, because she needed it, right? She needed the village, don't you
Yeah,
think?
absolutely. Yeah, very
Hmm.
much. Yeah, exactly. And it's really beautiful because she had some of the village already. And then Jen knew to reach out to you and bring in another close by person. Not only that you were close by, like just that's the kind of thing. It's like, how could that was so wonderful, because of course she reached out to you because she knew of you, but she knew of you because she knew your work because of what you've put out there. So this is why it's so great that you're putting your content out there, so that when she had this friend who actually also spends time there an hour away, yeah,
Hmm.
she could just go an hour away. That's it to get to you. Amazing. And then you kind of like then say, okay, it's just this beautiful time of collaboration where you're like, I know this, you got this, and she had a really good village. But you just said, what about this other area that could be pivotal? And I feel like our work was pivotal. Again, set up by you, so and by Jen. So I want to say that was all together. What a beautiful kind of picture of that journey. And yeah, like you said, it's we could just say that the alchemy of that. Oh, so alchemy. You I love your description and your translation in the languages, and the alchemy is about turning lead into gold, right? And it is this process that is not linear. It can't be. It's not just you take lead and you do a few things and you make gold. No, that's illogical, right? It's the mystic nature of that art that's been around for a long time, and it's perhaps not really necessarily we need to go into that, but I think that there is, if we take that as a picture of us, if we've suffered and struggled and had these issues, and we've had not just issues, but pain and trauma and things, and then we also just have things that haven't gone well in some procedures, right? That in this case, um, well, we can't just take that and do a few things. That lead is like that burden and that heaviness and that weightiness and that that material that we wouldn't say is illustrious and brilliant. Although I don't want to vilify lead over there, but then we take this transformation to turn into this this gold that has this nature, and gold is necessarily supple, right, and soft at its nature. It can become hard and become the thing that we view as like what we wear in jewelry, and then it becomes this thing that's very firm, but in fact it's very supple. So I think there's also something to be said about that aspect of, um, you can sometimes you need that village to help you feel supported, not just emotionally but also physically, so that you can let go of the guards and the vigilance and the things that kind of prevent you from your body from fully letting go. And I do think there's a big component of that in that case you just helped facilitate. So yeah, what a beautiful instance. And I think there's probably like so many people that come to mind for you. So I want to ask you a question that's, I have many questions that I want to ask you, and but I just kind of have this feeling of what's another case that comes to mind for you that you've seen in your practice, and it could be one you've collaborated with somebody on, but it just could be one that you've seen. Somebody's come through, you've seen this person, and you've seen something that feels like that compromised to alchemized that led into gold. You just saw like the role you played in that. You got to witness that. Is there anything? I know I'm putting you on the spot with that, but if you want to flow into another train of thought before you get there, go for it. But I'd love to know if anybody comes to mind, and if you just tell us a little bit, what that journey was like.
Yeah, as a pediatrician, I have two things to say. There's one case that just came to mind, and it's about letting go. It's an infant that I'm not seeing anymore. I'm not the provider. I'm not the pediatrician. It was this couple, and they had their firstborn, and people need to know about this. So hopefully your audience knows that we're out there and that we need to collaborate, and then that they can find help, and it takes more than one person. So this case in particular, it was a couple, 3-month-old infant, and we know that. I mean, I don't want to be overcritical about Western medicine, but as pediatricians in residency, I think we're taught, and you see it in the States or the Western world, we're neighbors, we're brothers.
Yeah.
It's all about the Band-Aid method, right? I
Yeah.
mean, I have a headache, I take a pill.
Right.
I have a stomach bug, or a stomach ache and I take a pill. I have a fever and I take medicine. And I like Dr. Kevin Boyd. I love this about fever. I always think about him, and he goes, think in evolutionary terms. I
Mm-hmm.
mean, things are there for a reason. So
Yeah.
I don't want to I don't want to go on a tangent, but this case would happen, Neil, and I let it go. It was a constant crying, reflux. I don't know, half a dozen medications, and they were skeptical to come to me because or reluctant because sometimes being too focused on oral tissues or tethered tissues. They didn't come to me up until 3 months old of their child because they thought my only proposal was going to be a tongue tie release,
Yeah.
a surgery. So
Yeah.
they were avoiding coming to
Uh,
me
right.
because they thought my answer to their problems was going to be you need to do the tongue tie release. So they come to me. They are pretty open about it. And she's also pretty active on social media, so she knew about me. She had done her homework, and it was this, the tension was there, and I just like sit at my office, and I just opened my brain and my heart and listened, and I just said, you know what? I think what you need is the combination of physical therapy and osteopathy. So, osteopathic care and physical therapy. And I said, like, I think eventually you're going to be able to let go or withdraw all your child's medications because I don't think they're making any positive difference with the reflux, with the crying, with the irritability, with the troubled sleep, all those things. I don't believe there's a need to uh to do any tongue tie surgery or release. And I'm not saying it. I told her I'm not saying it to be in good terms with you. I mean, I'm just saying from the bottom of my heart. So I connected her. It's amazing. I told you about the osteopath that I know here in Guadalajara, and we need to connect us three. So I send her, and thank God, God bless for the physiotherapist. I mean, my work has become so much easier. I mean, it's been a while, Neil, that I don't give any medication for colic, for reflux. I mean, at the most, I would give oral probiotics, and that's to say a lot. So I just say, you know what? Recently, what I've been working on is connecting with very good physiotherapists that know how to release the tension, and I know how they know to connect the body with the nervous system. And I know this is going to help your baby with digestive system, with their nervous system, with the respiratory system. It's going to help them sleep better. And it has happened. So this case in particular, I mean, and she keeps mentioning it on her social media. I mean, Dr. Erick, and she mentions like she's all about tongue tie releases. He's all about that. But he didn't do that to me and my
Mm,
child. Thank you to the osteopath and the collaborative work between him and
mm.
the physiotherapist. My baby is completely 180 another baby for the better. So that's a good case to make a point about what you're asking. I mean, how as a pediatrician I was able to say with a different lens, through a different lens, this is not about and we know about uh the power of the body to heal. It's impressive. I mean, what can you say about an ibuprofen as an anti-inflammatory that could be more potent or more powerful, sorry, than your own anti-inflammatory properties of your immune system? Sometimes, I mean, especially in common pediatric practice, So I think there's a big opportunity for us pediatricians to know more about the power of the emotions and healing. And I mean, the nervous system, you and I know we are very much fans of the nervous system.
Mhm.
I just have in front of me the book from Dr. Porges, the polyvagal
Yes.
theory, and that it blows my mind, the vagus nerve, and I know you and I are very passionate about the nerve, the vagus nerve. So So there you have it. That's what I could say about another case, and a few more thoughts about our presence and our goal as providers, as liaisons, or as people that could be like facilitators, right?
Yeah,
That's what I
very
would say
much.
about, yeah. So,
Yeah, I
so
love it. It's good. And
yeah.
um, the nervous system discussion is such a vital one. In fact, Donna Goals, who I interviewed on the podcast, who is the one of the main teachers of the continuum movement practice. It's like an embodiment practice. It's beautiful. And she's very much involved, like in life and partnership in terms of professional partnership and collaboration with Stephen Porges, and they're doing a lot of research. And it's really amazing to see that Stephen, with his work with the polyvagal theory, he really like has a big somatic component where he really values that transformation that can happen at the soul, at the emotions and the body, how they merge. And so if anybody wants to hear more about that, a little bit more from Donna Leah, check out that podcast. But what I want to say about you is that the nervous system, in that case, that was such an example of somebody came in, and of course you felt, I'm sure, the disappointment that that you would have wanted to have allayed their concerns earlier, I'm sure, and just been a safe place for them to be able to express what they want, because I know that's who you are. So I know that that's not easy when somebody says, or when that they've avoided because they thought that you were going to be very, very binary and say you need to do this because this is not, your heart for people. But you made it so that when they came in, you handled it with that care and nurture, and you could say objectively, but I would say it wasn't just objective. Objective is just neutral, right? You stay neutral. There's a little bit of the stoicism with that. And I think there's value in that. However, I think if we go one step further into like connection, and you approached it with care, holding space with their nervous systems in consideration, with their mind,
Yeah.
with it. So we need that, because we know with a mom and a baby and a dad and a baby, there's co-regulation in those early days, months,
Yeah.
years, until that child develops that nervous system where they can self-regulate. But I mean, hey, we can't expect them to do that in the first couple moments and years of life. But I think
Exactly.
also people, when we engage with them in that dyad or triad relationship, when they come in, right? Because it's like parents and a baby, they're one. You as a provider are one, and that's like this figurative dyad, right? However we want to look at that, you co-regulated with them to engage with them so that you could have a very good conversation, but without the tone of nervous system that you went into that time with,
Exactly.
right? You could have
Uh-huh.
been defensive. You could have said,
Mm-hmm.
oh, they didn't come to me, and you could have felt whatever you would have felt. I know that you wouldn't feel this, but we're
Mm-hmm.
all people that kind of feel it,
Yeah.
and I've had those moments where I'm like, I know there's some parallel cases that I can think of where people thought that I would have said this or I would have said that. And so, of course, my first moment of hearing that is like, oh man, like irritation, disappointment, but that is seconds. And then it gets to, how can I be a really soft place for them, a really safe place for them as well. And I feel like that was a good characterization of like your nature, because without a supple, regulated nervous system in that instance, like they could have had their concerns heightened. Even if you would have said the same thing, like, no, I'm not going to tell you to do a tongue tie release. You could have had a different tone, and you could have, but you came forth with this tone that welcomed them, and you also came forward with resources, and you shared honestly. But I think there's a lot to be said about the place from which you speak, and that is really such an intangible. So, first of all, that's like, I know undergirding a lot of your work is that, and you're just a person who cares. And then also, though, you're an expert. Your people are coming to you because they know you are an expert. You are a medical provider, right? So you have to also take that challenge, right? It's not a
Yeah.
negative thing. It's a weight and responsibility. So to juggle that, I know is a lot. And it's complex, and at the same time I feel that you are continually showing people, in this case I'm talking about you are continually showing people that you care, and when they know that, they can feel safe and settled. So that nervous system conversation is just such a pivotal one, because I think we can know all the things that I think something I want to highlight too is, just in case somebody's like looking for context even more. I mean, most people get it now, but there's some really good holistic integrative pediatricians that I've come across, and I love them and their work, and of course I love every pediatrician, but I mean I respect the work they do with what their field is, and then but it's really, really uncommon for one to have knowledge of the airway and feeding, and then that's tethered oral tissues. Beyond that, that's another step, and then beyond that is even considerations about the palate, and then beyond that is considerations about primitive reflexes and laser therapy, and we just keep adding layers of how unique it is for somebody to combine all of those perspectives, because you can have some of that and not the other. You can have holistic and functional and biological, but not necessarily have an expertise about airway and feeding. That is what I've run across, and so I've seen the families navigate. And with you, I see that you merge that, and you bring the perspectives of that, and I think that's really that's why I think it's a rare combination that you have. So. And how I introduced you back at the training in Reading, I said I usually have some, instances where I've had people come in. I mean, just countless patients have come in and told me about the experiences that they've had that were negative, where they weren't validated and they were gaslit. And, but I want to stick to these positive moments where you're bringing the opposite, which is validation, affirmation, with the knowledge to back it. And that's such a potent thing. And we need that, because in order to bring this alchemy, we can't just have the vibe. We need the intellect and the knowledge. We can't just have the intellect and the knowledge. We need to have that vibration. That's what I mean by vibe, right? That vibration of like resonance and healing and connectedness. So hopefully that wasn't too esoteric or symbolic. But yeah, Erick, thanks for you bringing that to the mix, and it's just a valuable asset. In these conversations, we do deep dives, and resources are aplenty, so please tune in and enjoy, and I'm so excited to have you along for the journey.